Hi, and welcome to Legal Affairs. My name is Diamond Liddy, and I'm the public defender for the 19th Judicial Circuit. I'm telling you, we are going to be talking about something that hopefully will help all the viewers and listeners today and tomorrow and the next week, unfortunately. And we have a wonderful, wonderful guest who is going to lead us through the topic, which I know we're all waiting with bated breath. What's the topic? But let me introduce our guest, and then we'll talk about what's going on. Welcome, Ann Posey. How are you?
Thank you, Diamond. Thank you so much for having me. I'm great.
Give me your title, and then I want to, before we talk about what we're going to talk about, give me your background. I mean, starting, back.
Okay.
I mean, not when, and I was born, and no. But anyway, give us your background and what you're doing now, please.
So I'm a licensed mental health counselor and a nationally certified counselor, and currently I'm the assistant administrator at the Behavioral Health Center at Cleveland Clinic, Indian River Hospital. My background is pretty varied. So I have a master's degree in clinical psychology, licensed in the state of Florida.
Wow.
And I've worked both for private and not-for-profit agencies. So I worked at a private psychiatric hospital for a number of years.
And where was that?
At Lawnwood, actually.
Okay,
I started as a unit social worker. So I started working on the units with the patients. Started getting into management. I ran the admission office there for a number of years, and then I went to work in child welfare for about 5 years. So I worked with Children's Home Society and United for Family, helping with the privatization of dependency case management.
And what's a dependency case?
A dependency case is when a child, there's suspicion or there is actually abuse and neglect of a child, and the child enters the foster care system or enters the dependency system where they have oversight, and patients, I'm sorry, not patients in that case, but families can get services to help them maintain custody of those children.
Right.
Then I went to work for the Community Mental Health Center, New Horizons. I was there for 10 years, did a variety of things at New Horizons. It's this place very special in my heart because they serve the severe and persistently mentally ill, which is one of my passions. Then I took a foray into juvenile justice, and I ran a program in Martin County called Martin Girls Academy. It was a program for...
Yeah, boy, I had forgotten everything. You have got the most wonderful, varied, but super great experience in all areas. I mean, we've been
like
around forever. Yes, but go ahead.
Well, one of the things that I forgot to mention that I did at New Horizons was run the mental health court program for a number of years, which again, those people who hit the criminal justice system with severe and persistent mental illness are often kind of forgotten about. So that's a wonderful program.
Yes.
So Martin Girls Academy was... I will tell you, it was one of the more challenging positions that I had in my career, but also one of the more rewarding.
Yeah.
So all those young ladies had severe and persistent mental illness, the big diagnoses, plus they had the bigger crimes.
Yeah.
And all of them had trauma backgrounds. So
every one of them.
Right.
Yeah.
And then I came back to inpatient psychiatric care, which I really love. And so I've been with Cleveland Clinic now for about 3 years. It was, I've actually come through the transition. So we were in Indian River Medical Center and then became Cleveland Clinic about almost 2 years ago.
And what exactly are you doing for Cleveland Clinic again, Ann?
So I'm the assistant administrator for the Behavioral Health Center. It's a 46-bed inpatient Baker Act receiving facility in Indian River County.
Right.
We serve all ages. We have a children's unit and 2 adult units in that hospital.
Wow. I did not realize that it was that big.
I say we're the best kept secret, I think, in Indian River County.
Well, I should know that. Shame on me. But I did not. I knew, I knew it existed. I did not realize that there were that many beds.
Right.
Wow.
And we also have a small outpatient program, and we're looking to do some kind of innovative things. We have a strong telepsychiatry program that has been a blessing, I will tell you, during this time.
Let me stop you there, and then we're going to get to our topic. I sit on the board for New Horizons, so I hear about all this and the telepsychiatry and stuff, and they say it works there. You're saying I certainly, respect both opinion. How in the world can it work though, Anne?
Well, I believe that.
And explain what it is. The patient and the doctor are not in the same room.
Correct.
They're doing it like a Zoom meeting.
Correct.
and having counseling over the TV.
Right. And if you think about how we do psychiatry or behavioral health counseling, we sit across from each other and we talk. So there's not a physical exam, we aren't touching the patient. So telepsychiatry actually is very effective. Psychiatry is a specialty, and because it's a specialty, psychiatrists are very much in demand. They're hard to find, especially if you need a child psychiatrist or someone with a bigger specialty. So we have nice big monitors. They're quite big, and the machine is in the room with the patient. The doctor comes on. He's able to see the medical record. He usually has a separate screen where he can look at the medical record and what's going on with the patient, and then he just talks to the patient.
Wow. And it's successful.
It's very successful. I will tell you, interestingly, our patients have less trouble with it sometimes than our caregivers. We get in our minds what it's supposed to be like.
Right.
But actually the patients, they really like it because the access is much quicker. So where we used to have about a 24-hour turnaround to see a patient on the medical floor in the ED, we can now do it in under 30 minutes.
Ooh, now I didn't think about that. Well, that factor trumps everything else,
Correct.
I think, obviously.
Well, because people want to be seen quickly, when they're in a crisis.
If they're having a breakdown or whatever, they need help now, not tomorrow at 10.
Correct. Or 6 weeks, when an appointment can become available on an outpatient basis.
Wow. Okay. Now, let's talk about why we're here.
Absolutely.
Obviously, I hate to talk about the C word, COVID, obviously, but it's here. It's going to be here for a while, unfortunately, and we have to deal with it. But everyone myself included, no matter how emotionally stable, no matter how you don't have persistent and severe mental illness,
correct.
People are having a difficult time with this, but we got to get through it. I mean, some more than others, and again, some obviously some are having issues to a greater degree than others. But it's anybody you talk to, no matter how strong, stable, what walk of life they're in, whatever. If they're honest, they're saying, this is hard.
Well, absolutely. It's a special kind of stress. Anytime that we're in a disaster situation, and a pandemic is a disaster, we know there are going to be certain responses that we're going to experience. So when you say everyone feels it, what that tells you is it's not mental illness, right? So we know that mental illness only affects a small portion of our society. So
I like that segue. No, because you do. At 2 a.m, you're saying, maybe I should call Ann and get some counseling.
Yeah, you're welcome to do that. But it's a normal reaction to an abnormal situation. So the APA actually, I brought some statistics with me. So the APA actually...
What's the APA?
The American Psychiatric Association, 70% of Americans are now reporting that the economy is a stressor for them, whereas a year ago, only 46%.
Okay.
Substance abuse and the SAMHSA, which is the Substance Abuse and Mental Health Center, they have reported a 1,000% increase to the disaster hotline, going from about 1,700 calls in April of 2019 to 20,000 calls in April of 2020.
Goodness.
So we know that this is impacting everyone. In a disaster, you see some stages. So initially there's panic and shock. I think we saw that. And then we get into what's called the heroic responder. So where we're, especially caregivers, you know, we're right in it. We want things to
Yeah.
right.
Right.
And you know, we saw the parades and, you know, people bringing caregivers food and all those kinds of things.
Right.
And then we get into the honeymoon phase. We've got this, you know, things are going along. We know how to deal with this. But as a pandemic stretches on, we start to fall into what's called disillusionment. So this is continuing. We're still having the same amount of stress. Some of those things like parades are going away, you know, and it's kind of day-to-day business. And what we know we'll see is what's called the mental health surge. So traumatic stress outweighs physical stress by 4 to 1. So we know in Katrina, deaths, the amount of deaths we have 4 times the number.
Well, let's go back. Whoa. Traumatic stress. Say that again.
So in a disaster, you'll have physical reaction. I mean, people will die. People will be injured.
Right.
What we know is that traumatic stress outweighs that 4 to 1. So we're going to see stress reactions outweighing deaths and illnesses and injuries, probably 4 to 1 moving on.
Whoa. And it, okay, so are those all the stages then? So what stage are we in now?
I would say that we're probably getting into the disillusionment stage.
And when you say disillusionment, in other words,
will this ever be over? You know, are we making a difference? I'm tired, I'm stressed, I don't know what the future holds. You know, more of that stress reaction than the hopeful feelings.
And is that normal?
It is.
Okay.
It is. And
so it's okay to feel, so if you're watching this and you feel disillusioned, you're right with all of us.
Correct.
Okay.
Right. It's a very normal reaction. The nice thing about knowing that is when we have information, we can do things about it.
Okay.
So there are things we know will happen when we're under stress. We may have trouble eating. We may have trouble sleeping. We may feel anxious and depressed. We may cry more. We may have anger. You know, we may see anger. Children will react even differently than adults. So in children, you may see some regressive behaviors. You know, a child may be starting to bedwet again or feeling very anxious, having tantrums.
Right.
Adolescents, you may see more acting out. You may see more substance abuse. And those are all things we would expect when people are under high levels of stress.
And so what do we do? How do you handle this? How do you get through it? You know, as we talked before the show, my general nature is to be upbeat and happy. People depend on me to be upbeat and happy, but I have to say, there are days when I just can't get it up, and that is so, how do I coach myself? How do I get back to normal so that the people, you know, as a parent, your kids want mommy and daddy to come home and be happy and make dinner and talk about, you know, they depend. There's so many people depending on us, whether you're a CEO of an organization or a mommy and daddy at home, and it's hard to.
Well, and I think it's okay to acknowledge that. To give yourself a break, so to speak.
Okay.
We are encountering something we've never encountered in our lifetime, and hopefully we'll never have to encounter in our lifetime. I mean, I feel it too. So my daughter, who is expecting her first baby out in California, my first grandchild, you know, we did a virtual shower. You know, those things that you expect and anticipate, and it's sad.
Right? Yeah.
So we need to acknowledge that it's sad. But one of the things I said after that virtual shower is, I know she felt the love. She knew she was loved. Right. So look for the gifts. So we need to look for the gifts. But I think we need to pay attention to our bodies. We need to pay attention to what our bodies are saying to us. we need to learn to tolerate some anxiety and worry in our lives. And those of us who are pretty good at dealing with it,
Right.
this is new. So I'm pretty
Right.
upbeat as well. So it's kind of new to me to have more anxiety or more sadness,
Right.
than I've had in the past. So
Right.
I need to be aware of that.
Well, and let me stop. You, in picking yourself up, there is no one of the things I do is go through how the things that have I benefited from this pandemic.
Right.
I mean, there are things, I don't know if you've heard about it. There's a thing that you can buy called Masterclass. And it's all these famous people, everyone from Steve Martin, to Penn and Teller, the magicians, how to be a magician,
How to play the banjo.
yeah, how to play the banjo, all of those things. I would have never done any of that not for this pandemic. So there's things at my home that I have done. And I look at all those things, and so when I'm sad, I can say, yeah, but look how I benefited.
I call that looking for the gifts.
Right.
So in every difficult situation, I believe there's a gift. Sometimes we have to look really hard for that
Right.
silver lining within the cloud, but there is a gift in everything. And that's a great strategy. So you don't need me, right?
Oh, yes, I do.
That's a great strategy for building resilience, is
Right.
looking at what you've accomplished. We need to learn to be able to tolerate anxiety to some degree. So we're not a society that likes to tolerate things that are uncomfortable.
Right.
But I think we're all worried. So recognize when you're worrying. Also recognize worrying isn't very helpful. Mark Twain had a quote that I use frequently in talks. It's, "I'm an old man. I've had many worries, most of which never came true."
Right.
So if you think about all the things you've worried about in your
Right.
life, a lot of them have never come to fruition.
Right.
So write them down. When you're worrying, start to write down those worries and give yourself 15 minutes a day where you're going to devote to worrying and problem solving and dealing with that.
And then just
and then move on, right? And move on. So I will tell you, when this first started, I work in a hospital. We didn't know what this was going to look like, and I thought, I could get sick. I'm starting to get in that age group
Right.
that could be high risk. And it worried me. So I thought, well, what can I do? So we need to problem solve. So I did a couple of things that may seem a little weird, but I updated my will. And I wrote down all the passwords, because if something happened to me, my husband would be lost, right? And I sent them to my daughter so that, and I will tell you, that made me feel better, because I felt like I had taken some steps.
Wow. Okay.
I can't change whether or not I get sick or whether or not something bad happens to me, but I can take some steps to feel like I'm in control.
More control. I gotcha.
Right. Think about when you start to worry, anxiety is what if? Well, what if this happens? What if that happens? What if the other thing happens? So counter that with, so what? So what can I do? Make a list of plans. If you're worried that your income is dropping, so what can I do? Well, maybe I can become an Uber driver. Maybe,
Right.
Maybe I can do DoorDash, because that's quite, something people are using. I'm certainly using it a lot
Right.
more than I used to. So look at problem solving and different things you can do, and have a plan A, a plan B, and a plan C.
And literally write these things down.
Absolutely.
Okay.
Lists are great.
Yeah.
I love lists.
Oh, I do too. I do too. What else, Ann?
Well, we want to build resilience. So one of the things we know is that you and I, at least, have survived 100% of the bad days we've had to date. Right? There were days that we didn't think we were going to survive.
Oh gosh,
Right?
that's great. Okay.
I've been through a lot of difficult times in my life and my career.
Right.
Dealing with illnesses in the family, or different things that have happened in my life that I will tell you, at the time I thought, I'm not going to get through this.
Right.
But we do.
Yeah.
So we need to think about what helped us get through that during that time. Did we talk to somebody? Did we make plans? Did we see a professional person?
Right, right.
And do those things again. Okay?
Right.
So we can learn from that. So we need to start building resilience within ourselves. Think about who was supportive, who was helpful, who gave us useful advice. Who do we really not want to talk to?
Yeah.
Because they really weren't all that helpful.
Right, right.
And recognize that those things that help then can also help us now. We also want to be a little more optimistic. There's what's called realistic optimism. We can be a pessimist and think that the worst possible thing is going to happen, or we can be a little more realistic. So when we look at the news, we can look only at the death rate, or we can look with COVID, or we can look at the survival rate.
Right. Right.
So we can choose to say this is difficult, but we will get through it. We've gotten through a pandemic before, with the flu pandemic.
Right.
So we will get through it. It won't look the same. It won't be the same, but we can be more optimistic than pessimistic.
Right. Right.
And that's helpful.
I think one thing that bothers me is the what's the word I want to use? Just accepting a new normal. Mm-hmm. And I don't want to accept a new normal. I think we're texting too much, we're Facebooking too much, mm-hmm. We're not having the human contact. And I think this is going to exacerbate the already bad road we're on.
Well, the social distancing is probably, I think, the toughest part of this and one of the bigger stresses that we face. I'm a very social person,
right.
And I am thankful every day that I go to work every day, because I think that if I were working from home or not working, that would be a challenge for me, because I need that human contact.
Right.
But again, I think we'll have a new normal, but I don't think it will be this normal. So I think we'll get a vaccine, we'll be able to have human contact again.
Right.
But we may keep some of those things that have been helpful. I'm a big fan now of webinars and Zoom meetings and things that help me be a little actually more productive in some fashion.
Right. Right.
So I don't think this is our new normal. And I think if we get caught into this is the way it's always going to be, I don't think that's accurate.
Right. So you just got to pick yourself up and say.
This is a period of time.
Right.
We need to get through this period of time.
And it'll get better.
And it will get better. We know it will get better.
Right.
We can look back at historically at many, many disasters. You can look at Hurricane Katrina, which was devastating, for New Orleans. And they've gotten back to normal and in some respects better. Can look at wars and other big traumas that we've had, and the depression. We get through it. So that realistic optimism that we will get through it, and it won't be the same world, but the world needs to change, right? We want it to change.
Okay, no, I'm taking this all in. I'm getting my counseling session too. Believe it or not, we got about 5 minutes more. What else can you tell us?
Well, we need to do good self-care. So this is the time where we need to eat right. We need to exercise. We need to stay in as much of a routine as possible. One of the things I found is I was getting out of my routine. So exercise for me is hugely helpful for my stress.
Right.
I wasn't able to go to the gym, so I joined the ranks and bought a Peloton. And I will tell you, it's been hugely helpful for me, because I'm able to get in that regular exercise that helps me.
Gotcha.
This is also the time we don't want to indulge in alcohol to greater extent than we normally do. I'm not saying you have to teetotal, but we are seeing a rise in substance abuse. We're seeing a rise in overdose deaths.
Yeah, significant?
Significant.
Wow.
Yeah.
That's
so we want to do those good self-care things. And if you find that you're experiencing anxiety and depression, it's not going away, these things aren't working, there's a ton of professional help out there now. And it's actually much more accessible, because a lot of people are using telehealth and telecounseling, and you can sit in the comfort of your own home and talk to someone, which helps that stigma.
Right.
I need to talk to someone I don't.
And I don't want to sit in a waiting room and people know I'm here.
Or sit in a waiting room where people might be sick.
Right.
So I think that those things are really super important.
What locally, and what are the numbers? Is it we all know about 211, or you know?
Well, 211 is a quick, easy way to get referrals and resources.
Okay,
so each county's a little different.
Okay.
But there are a lot of places out there doing a lot of innovative things. I know New Horizons, for instance, has their mobile response team. You know, we see people at Cleveland Clinic in the emergency departments via telepsychiatry in all of our emergency departments. So there are lots of resources. In Indian River County, the McCabe Connection Center is a great resource to link up with services.
So they can call and we're talking about poor people that don't have health insurance. They can get services and
Absolutely.
help too?
You know, I'm on the board of the Mental Health Association in Indian River County. They do free screenings based on ability to pay. There are a lot of resources out there for people. And 211 can link you with the appropriate.
So that's probably that's your first go-to is the 211, and then they can get you hooked up and get you some help.
And they will also link you to the suicide hotline if people are in distress. That's a great linkage.
Have suicides risen?
So I don't think we have the data on that yet, but I think in a year we'll probably see things like the suicide rate, the murder rate, domestic violence, child abuse. I think we'll probably
domestic violence. You know, I know from my standpoint.
We'll see rises in all of those. That's pretty common after a disaster.
Well, people. So what are in ending? We've got a couple minutes. When we get through this, and we will, are there long-term, are we going to have post-traumatic stress syndrome?
So some people may. I think you may see some of that.
Okay.
But what I believe is that human beings are incredibly resilient.
Not just children.
Not just children. I think adults are too.
Okay.
I think you'll see a portion of the population that will have significant stressors. We saw that after Katrina, for instance. But I think the majority of the population is going to learn and grow and be resilient, and we will, hopefully be better for this.
And I see that. I see that in my office. I'm sure you see it. And just in ending, so everyone knows that you work with people with many years of advanced education. They're doctors, they're psychiatrists. You work with very highly educated people. They're having the same problems cook at Applebee's is having.
They are. One of the things that I love about Cleveland Clinic is we talk about everyone that works at Cleveland Clinic as a caregiver. So it doesn't matter if you work in the kitchen or you're the CEO, you're a caregiver. And caregiver stress during this time is high and on the rise. I will say I was able to do a webinar for the physicians at Cleveland Clinic.
Right, because they needed help too.
Well, to talk about moral injury and the fact that this is really difficult.
Oh wow! And they came and listened.
Did. They were quite attentive. So moral injury means that you feel that it's not so much that you did everything you could, but you did everything you could with what you had available, which is very different, right? We're not used to not knowing what to do, right? Not having a vaccine. So it's hard for everyone, including physicians.
Anne, thank you. This was wonderful.
I'm glad to be here.
Much.
Thank you. Thank you for having me.